Hello, everyone. Welcome to the Medical Careers Day for the Faculty of Pathology. I'm just going to give you a bit of information today on the specialties in pathology. And in the faculty, we look after 5 main specialties. We look after chemical pathology, clinical microbiology, haematology, histopathology, and immunology. And there are higher specialist training programs for all of those. For histopathology, there is a basic specialist training program as well that you would need to do in order to go into higher specialist training in histopathology. For the other specialties, though, you would do your BST in general medicine. So for today, I have 2 videos for you. One of them will be, you'll hear from some of the national specialty directors in pathology. We have Dr. Cillian de Gascon talking about clinical microbiology, Dr. Mary Kilgan talking about immunology, and Dr. Cynthia Heffron talking about histopathology. Following that, we'll have a video with talks from some of our current trainees who I'll introduce in between the talks. And then at the very end, we'll have some time for Q&A, and we'll be joined by National Specialty Director for Histopathology, Dr. Cynthia Heffron, and the BST trainee representative for histopathology, Dr. Katie Beesham. So I will get the first video up and running for you now.
Hi, Cillian de Gascon is my name. I'm a consultant virologist and I'm the current NSD in clinical microbiology. So today I want to talk to you about why you might choose a career in clinical micro. First of all, laboratory medicine or pathology really is at the center of the journey of the vast majority of patients. They will all, or certainly the vast majority of them will have either bloods taken for haematology, they'll have bloods taken for biochemistry, they will have specimens taken and sent to the laboratory for bacterial culture, or they may have CSF sent for a viral meningitis or encephalitis screen. So really the laboratory is a huge part of how we diagnose and how we treat patients in medicine today. From the point of view of a medical career, you really have to find something that you're interested in. When we talk about laboratory medicine across the specialties today, if you don't like being in the laboratory, if you're really married to the idea of seeing patients and being an outpatient for the rest of your career, well then that's what you should do. Laboratory medicine isn't for you. But if you're uncertain as to what your career holds, then you should definitely consider laboratory medicine, and in particular clinical microbiology or virology. The reason I would recommend these as a career is, firstly, well, I'm obviously very interested in what I do, which makes things easy. But laboratory medicine gives you the best of both worlds. So certainly if you're in a clinical microbiology specialty or in a training post, you will have the opportunity to make the post as clinical or as laboratory based as you like it. So there's a huge variety there. What I like about infection is the fact that the bugs and the pathogens are continually evolving. So there's an ongoing battle. It's not just about identifying a disease and then managing it chronically. Things change. Obviously, antimicrobial resistance emerges, new bugs emerge, new viruses emerge. So there's always likely to be something new. Like I got into infection virology because of HIV back in the 1980s. But if you look at the intervening 30 years, we've had an influenza pandemic, we're in the middle of a coronavirus pandemic, we've had another coronavirus pandemic in 2003, and so new pathogens continue to emerge all the time, and pathogens move around the world. So we get infections that would have been common in one part of the world a number of years back emerging in Europe and spreading across Europe. So I find that interesting. The other appealing aspect about laboratory medicine is that you do have information first. You're not chasing down results all the time. You have a huge amount of access to knowledge and a huge amount of information that allows you to inform patient practice. You get to collaborate with pretty much every specialty throughout the hospital. So you do get a huge variety in that respect. You might be dealing with cardiology one day orthopedic surgery the next day. So if you're the type of person that likes a bit of variety in their post, but also you like to be able to inform patient management and provide input, then clinical microbiology may well be for you. From a training perspective, we've got about 26 trainees at the moment. It's a 5-year training scheme. There are great opportunities for research. There are great opportunities for audit and for quality improvement projects. There will be an increasing number of jobs coming on stream because of infection prevention control issues following the pandemic. Antimicrobial resistance continues to be a challenge. So one of the elements that you need to consider is listen to, I suppose, what's going on in the media and in the news about infections, and see if that's the type of thing that might interest you. And if you're interested in infection, then clinical micro is worth a try. The other thing to bear in mind is that it is a nice job from the point of view of work-life balance, except for the last 6 months. So if you're in the setting of a pandemic, infection may not be the best specialty for you, but generally speaking, it's a job where you can work hard when you're in work, but then you can turn off the phone in the evening, because you don't have outpatient clinics. You won't have patients who have your number. They won't be calling you. There obviously isn't a lot of private practice, but at the same time, you shouldn't go into laboratory medicine or into clinical micro or any specialty purely based on work-life balance. You have to have an interest in your specialty, otherwise it gets very difficult very quickly. So we're here to answer any questions you may have, and all the very best with your decision. Thanks a million.
Good afternoon, my name is Mary Keoghan. I'm a consultant immunologist in Beaumont Hospital and NSD for immunology. And this afternoon I'd like to talk to you about careers in clinical immunology. Clinical immunology is an integrated clinical and laboratory specialty, and as immunologists we play a role in investigating and managing patients with conditions which are caused by a wide variety of immunological abnormalities. There are two main areas of practice. Immunologists play a key role in the immunology laboratory, which may also include a specialty laboratory such as transplant immunology. We also see patients, typically in outpatients, ward consultations, and as day cases, and in some centres, immunologists are also admitting physicians and may have inpatients under their care. In the laboratory, ultimate responsibility sits with the consultant medical director. The role is to ensure that the lab is run to accreditation standards. Consultants play a role in direct reporting of complex assays. There's a role in overseeing quality assurance and quality control, as well as educating users both before tests are sent and also in interpreting results in complex situations. Consultants play a key role in the strategic development of the laboratory, deciding which assays should be introduced and added to the repertoire. Clinically, the patients we see are those with immunodeficiencies, varying from mild to the very severe immunodeficiencies typical of the boy in the bubble. We manage patients with allergy, and in collaboration with organ-based specialties, we will see patients who have complex autoimmune disease. Those of us involved in transplantation aim to avoid the disaster shown at the top of the slide, which is a rapidly rejected kidney. So what's good about immunology? Well, it's really interesting and varied. There's very rapid scientific progress. We interact with all specialties and our colleagues in the community. Part of our role is to integrate science, laboratory data and clinical information to help complex patients in difficult clinical situations. Every week is different, and even in a busy clinical job, there are opportunities to undertake clinical research which makes a difference to the long-term outcomes of patients. There are things that aren't so good. At present, we don't have enough consultants, which means we're all very busy. However, from a trainee point of view, that's good because it means there will be an expansion of the specialty and more jobs. Posts will also always be in large academic teaching hospitals. So for people who want to live in rural areas, it's unlikely that there will be an immunology post in their local hospital. Constant change is part of what keeps it interesting, but at times it can be challenging. To be a good immunologist, you need to be interested in immunology, not just clinical aspects, but also the basic science. In the laboratory, you need to be organised and methodical. Clinically, you need very good clinical skills, as you'll often be seeing patients that other consultant colleagues have found difficult. Allergy is a bit detective-like, and you need really good history-taking skills. You need to be pragmatic and able to make decisions. You need to be able to manage yourself and others. You need excellent communication skills and to be able to influence and negotiate. And you need to have good scientific insight and to be able to critically analyse data coming from different sources. The training pathway after internship involves undertaking BST, usually in medicine, but you can do paediatric BST, and acquiring the RCPI. We would advise you to choose a scheme which gives maximal exposure to related specialties. The HST programme in Ireland includes the requirement to pass the FRC path in immunology, and therefore you will have an internationally recognised qualification. A higher degree is encouraged, but not essential. If you think you might be interested in immunology, I would advise you to make contact with an immunology department and see if it's possible to undertake any research or audit, or to do a clinical elective or observership. Even spending a few days in a department can really help you decide if this might be the career you would enjoy. It's important to spend some time in a diagnostic lab to ensure you enjoy this, as if you don't enjoy laboratory medicine, you probably won't enjoy immunology. During internship or SHO training, consider undertaking audits with immunological relevance or getting involved in collaborative studies if you get the opportunity. So thank you for your attention, and feel free to email me if you'd like any further information.
Hello, my name is Dr. Cynthia Heffron. I'm a consultant histopathologist in Cork University Hospital, and I'm also the National Specialty Director for Histopathology with the Royal College of Physicians of Ireland. And today I'm going to tell you a little bit about being a histopathologist and what it means. And when you ask people in general what do they think I do as a pathologist, most of them will think I'm involved in the diagnosis of death, crime, as you can see from this survey done in the UK in 2005. And most people will think I've come out of some version of CSI and that I spend my days doing autopsies and figuring out causes of death, silent witness, or even if you think of our own retired state pathologist, Professor Marie Cassidy, who was recently on the Late Late Show talking about her book on her career. And that's what a lot of people think I do as a pathologist. But really, what do we really do? Only a very small proportion of pathologists will actually become forensic pathologists, and they will have to go through a career of histopathology in the first instance, which makes up 22% of pathologists. And then the other specialties will make up the remainder, such as haematology, chemical pathology, immunology and microbiology. So what do we do as pathologists? We combine aspects of biomedical science with clinical aspects of medicine. A lot of us work in laboratories, some work in clinics and on hospital wards, including the microbiologists. And we help make decisions that will help our clinicians decide on patient treatment and likely prognosis. And if you look at it, pathology is involved in 70% of all diagnoses. But patients are often unaware of the contribution of a pathologist to their healthcare. And as I said, only a small percentage actually become the forensic pathologist that you will see in CSI. And pathology is the study of disease, and as I mentioned, there are 5 main disciplines: histopathology, microbiology, haematology, chemical pathology, and immunology. And pathologists really are at the centre of diagnosis, treatment and prevention of illness. So if we look at how many trainees we have in RCPI in the various disciplines, histopathology is by far the largest with 69 trainees. And clinical microbiology of 28, followed by haematology with 27, and then a smaller proportion in immunology and chemical pathology. So this is what I do on a regular basis. This is my own microscope from my office, And this is where I spend most of my day, looking down the microscope at tissue, making diagnoses for the patient. And this is an example of a case that I might be looking at on a daily basis. So this is a lesion behind a gentleman's ear. You can see it's quite a nasty looking lesion, very dark. And this is excised by our surgeons and sent in to the histopathologist. So this is what happens. It arrives in a formalin, bucket of formalin. We then have to select the pieces from that tissue to be processed and be put into a wax block, which then is cut onto a slide, and I get the H&E, or a lipstick stain, as a plastic surgery registrar said to me one time. And we get this slide then to put under the microscope and make our diagnosis. And this is a slide from that tumour that you saw behind that man's ear, and this is the overlying skin. Underlying it we have this large tumour with a lot of melanin pigment, and this is in fact a melanoma. If we look at higher power, we can see the whites of the eyes of these cells to see what they're actually doing. They're making melanin pigment, and this is indeed melanoma. Melanoma is the fourth most common cancer in Ireland, accounting for 5.4% of all malignant neoplasms, excluding non-melanoma skin cancer in women, and 4.5% in men. And these are data taken from the National Cancer Registry of Ireland. And one of the big advances in a lot of what we do in histopathology has moved along the pathway of molecular pathology, and within metastatic melanoma it was a huge development in 2010 when melanoma was found to have mutated BRAF, and that inhibition of this mutated BRAF could in fact help the treatment of melanoma, metastatic melanoma in our patients. And there were some very dramatic images from this. This is a patient prior to treatment with the BRAF inhibitor. This is a PET scan showing all these black areas lighting up our metastases when he was treated with the BRAF inhibitor. 2 months later he was clear. So this was very dramatic images published in the New York Times to illustrate the effect of a very specific inhibitor against a mutation that that particular melanoma had. What was our role as the pathologist? Well, now we have to make that diagnosis. We have to establish the presence or absence of that mutation, and with the BRAF mutation we now have an immunohistochemical test as well as molecular test to identify the presence of that mutation. When there's abnormal expression of protein, we can illustrate it with our little brown stains. As you can see here, in this patient indeed has a BRAF mutation, and this is a comparison in our own lab looking at the various methods you can use. So that was just an example to take you through what I would do on a daily basis and what kind of skills you might need as a histopathologist. Well, attention to detail for examining tissue and diagnosing disease. Many diseases look very similar, so being able to spot small differences is important. Like with any area of medicine, you need an ability to work under pressure and make critical decisions every day, as our interpretation of what we see under the microscope will determine what treatment that individual patient is given. We have to be organised, and again, like most areas of medicine, all areas of medicine, we must have good communication skills. It's not just patients we're communicating with, but their clinicians and our colleagues and others within the laboratory and within the wider hospital. So how do you become a histopathologist? Well, we're unique among the histopathologies in that we have a basic specialist training scheme in histopathology. The other pathologies, you need to do a general medical scheme first and then go into the various pathology disciplines. But for histopathology, there is a 2-year BST scheme, and this is followed by 4 to 5 years in higher specialist training. Rotations, most trainees will be required to rotate between Galway, Cork, University Hospital Waterford and the various teaching hospitals in Dublin. A big part of training in histopathology are the Royal College of Pathologists pathology exams. So there's an F4C Path or Fellowship of the Royal College of Pathologists, and there's a Part 1 and Part 2, and this is required to exit your training scheme. There are lots of academic opportunities from laboratory and clinical based research for your MDs and PhDs, and you can do this as part of your HST. There's a lot of teaching opportunities, from teaching undergraduate, graduate entry medicine students, as well as other areas. If you like careers in pathology, a lot of people will think you can get a good work-life balance in pathology, and indeed you can, because I suppose you don't have those weekends on, the nights on, unless you become a forensic pathologist possibly. Part-time work is feasible, and we certainly have more interest in a lot more trainees looking to work part-time through the flexible training schemes provided by the HSE and job share opportunities. So how would you make yourself more competitive for entry onto the training programme? Well, like with anything in any discipline, show interest and inform yourself of what you're letting yourself in for in your chosen career. So just to finish, I wish you all well. I hope you will consider a career in histopathology. I'm 20 years now as a histopathologist, and I still find it extremely rewarding discipline, and I couldn't imagine doing anything else. So I wish you all the best in the future. Thank you very much.
Okay, I hope you found that interesting. I now have another video for you, and this comes from some of our current trainees in pathology. We'll have Dr. Aaron Doherty talking you through clinical micro, Dr. Jacqueline Sui talking you through immunology, Dr. Valerie Broderick talking about haematology, and Dr. Greta Gambosi talking about histopathology. So I'm just going to call up the second video for you.
What does a clinical microbiologist do? Well, primarily they're involved in the diagnosis, treatment and prevention of infection, and these are often caused by microorganisms such as viruses, bacteria, fungi or parasites. So broadly, what does the training look like in Ireland? Well, it's a 5-year training scheme, 2 years of which are usually undertaken in Dublin-based hospitals, and 3 years are undertaken in large towns or cities with hospitals outside of Dublin. It's important to mention as well that there are 2 exams that need to be passed in order to complete your HST. This is the Fellowship of the Royal College of Pathologists UK, Parts 1 and 2. Part 1 is usually taken after your first year of microbiology training, and Part 2 is usually taken after 3 or more years of microbiology training. What does the day-to-day look like? Well, usually most days start with a laboratory round, getting the most relevant and recent results from the laboratory scientists, and also asking them to do further workup on clinical specimens as required. We also authorise results and phone urgent results out to the clinical teams. Usually most hospitals will do an ICU round on all the patients currently in ICU, reviewing them for infection and reviewing the antibiotics that they're on. Some hospitals may also do ward consults, reviewing patients with difficult or complex infectious processes. Also, we often attend MDTs, particularly patients who are vulnerable to infections, such as haematology patients or transplant patients. So why choose clinical microbiology? Well, it's a stimulating, ever-changing field, and you never know what might grow on any day. There's always new challenges, drug resistance, such as MRSA, CPE, multi-drug resistant TB or extended drug resistant TB. And there's also re-emerging and new diseases, such as Zika virus and, of course, SARS-CoV-2, which we've recently seen. As well as that, there's new treatments, which of course some cause immunosuppression and therefore create new challenges as we see infections in those patients, but also new antimicrobial agents which we can use to treat resistant organisms. It is quite a specialised field, but we work with almost everyone, from infection prevention control nurses to obstetrics and gynecology to engineering, facilities, governance, and we work of course very closely with our infectious diseases colleagues as well. And of course, microbiology does offer quite a good work-life balance. So by the end of your training scheme, you should know how to diagnose, treat and prevent infection. You should know how to manage a working clinical laboratory, how you would manage an outbreak setting in a hospital, and how you would promote antimicrobial stewardship in the hospital setting. So what qualities do you need to be a good clinical microbiologist? Well, you need to be a good communicator. You're often giving very complex clinical advice based on a history that you heard over the telephone. You need to have good clinical knowledge, as all tests need to be interpreted based on the clinical picture. And you need an interest in science that underpins clinical medicine, particularly as science is rapidly changing and our techniques and equipment are also often changing, as are the infections and the treatments that we prescribe and advise for them. So you've decided that you want to be a clinical microbiologist and you want to get onto the microbiology training scheme. So what are the entry requirements? Well, apart from obviously being a doctor and having completed your internship, you must have completed your basic specialist training. Now, most trainees usually do the medical basic specialist training and the medical membership exams, but in fact you can apply with any BST, such as pediatrics, surgery, obs-gynae, etc. Also, it helps if you've demonstrated an interest or if you have experience in the microbiology field, if you've spent time shadowing a microbiology team, or if you've actually worked as a registrar in microbiology or an SHO for a period. If you have any further questions, or if you're interested in microbiology and would like to talk about it more, feel free to contact me through the college and I'll be happy to have a chat with you.
Hi everyone, my name is Jacqueline. I'm the current immunology trainee rep this year. I'm currently in my 4th year of clinical immunology training in St. James's Hospital, Dublin. I'm hoping to give you a tiny glimpse into life as an immunology trainee. Clinical immunology specialty is a relatively small specialty with only around 6 consultant immunologists and 7 trainees covering the adult immunology service in Ireland. Consequently, many people have little exposure to immunology field, and I hope to give you a flavor of what working in this specialty entails. Most of our days include a mix of clinical work along with lab time and liaison with other specialists. An average day may begin with clinics, which normally includes both new and follow-up patients. All trainees take part in clinic covering immunodeficiency, allergy, and autoimmune disease. Patient that requires further investigations involving skin testing, challenges, or infusions, mainly immunoglobulins replacement, are seen in our day ward. Due to the multidisciplinary nature of the work, we work closely with our nursing staff, clinical scientists, and other medical specialty. After a clinic or a day ward, the rest of the day may include seeing consults in the ward or lab work. As a trainee, we need to have knowledge on assay use in immunology lab. Clinical immunologists are usually also responsible for running the immunology lab. A key part of our training therefore includes quality control and lab management. We may end the day by authorizing results. This involves reviewing any abnormal results and, if appropriate, provides relevant clinical interpretation. We also often receive calls for advice on lab results as well as clinical queries. This is a very exciting time to be involved in immunology, as important immunological research is driving rapid evolution to our understanding of the immune system. If you have any further queries about the training, I will be more than happy to be contacted through the college for any further queries. Thank you.
Hi, my name is Valerie Broderick and I'm a 5th year haematology SPR. I'm going to give you a brief overview of the higher specialist training scheme from a trainee's perspective. So my journey began from going from home in Cork to study medicine in Trinity, and ever since I've been dotted around the country in various hospitals, as you can see. So what exactly is a haematologist? Well, there's 4 distinct subspecialities to haematology, although most haematologists are general. Benign hematologists deal with things like leukemia. Benign is concerned with things like sickle cell. Hemostasis and thrombosis deals with bleeding disorders and clots. And transfusion hematologists provide safe blood to people who need it. All of these jobs have both clinical and laboratory duties, as well as duties in research, clinical trials, education and quality improvement. So if you're interested in haematology, how do you get into it? First of all, you do your intern year, and then you progress to doing a BST in either medicine or surgery medicine or pediatrics for 2 years. After this, you might decide to do a standalone red year to decide you like haematology, or some of my friends have 5 years, before applying for the higher specialist training. And once you've been successfully given a space on the higher specialty training scheme, you do 4 to 5 years. After this, you might do a fellowship or some research, and then ultimately you're a consultant. So how do you make yourself more competitive to get onto this training scheme? Completion of the BST and acquisition of your MRCPI exams is mandatory. It's great to have experience in haematology, either as a standalone job or as a BST rotation, as well as exposure to the laboratory aspects of haematology. It's really good to have experience in audit, quality improvement or research in the area of haematology, and successful candidates have a passion for both the clinical and laboratory aspects of haematology. So yippee, you're on the scheme. What can you look forward to? So generally there's 4 or 5 years, with 2 of these years being based outside of Dublin and 3 in Dublin, where you do your mandatory rotations in the Transplant Centre in James's, National Coagulation Centre in James's, IBTS in James's, and Paediatrics in Crumlin. As well as this, you'll have to undertake some exams, your Part 1 as well as your Part 2, and it's necessary to successfully attain these exams in order to achieve your CSCT. There's some really good things about being a haematologist, like using new targeted medications, and you can look at objective-based parameters like hemoglobin, white blood cells and platelets to assess patients' response to therapy. You get to build up a really close relationship with your patients and their families over the year, and your time can be split between the clinic and between the lab. So when things are a bit intense in the wards, you can escape to the lab. It's great that you get to look after sick patients with multi-system complications, as this helps to maintain a level of proficiency in general medicine and interact with other teams. And you have great autonomy in making a diagnosis. By taking a good history, looking at blood film or a patient's bone marrow aspirate and trophine, you can basically diagnose a patient by yourself without involving any other medical specialities. The cons, the scheme can be quite competitive to get on, and the clinical aspects tend to outweigh the laboratory times. There is an intensity associated with the clinical aspects of haematology, where you tend to work hours longer than 9 to 5, and ultimately patient mortality and morbidity often results in poor outcomes. On call, which I'll talk about later, and some people would say a requirement to sit exams is a con. So the call is off-site on call, and you take calls from the hospital and give advice regarding patients, and then you work as normal the next day. The frequency can be variable, as can whether or not it's a standalone haematology call or a joint on call with oncology. It's also variable whether or not you have to attend the hospital to admit patients, or whether or not they're admitted by an SHO on call in the hospital. Work-life balance, as with everything in medicine, can be challenging at times, and it's really important to try and maintain outside interests. It's helpful to know where you'll be based for your training, and it's excellent that there's a strong number of female consultant role models. You have options for flexible training or job sharing, and personally I think I have managed to achieve a good work-life balance while maintaining competency in haematology and completing the HSC program full-time. If you have any questions, please don't hesitate to ask me, or alternatively I can be reached on this email address. Thank you for your time.
Hi, my name is Greta and I'm a second year SHO in histopathology in Dublin. If you choose histopathology as your future specialty, you have to accept that it will involve a lifelong commitment to explain people what you do. If you're lucky, some of your peers in medicine will have a suspicion, but most people associate pathology with postmortems, cold bodies, neon lights, basement offices, and way too often CSI. But actually, it's so much more than that. It is a very important diagnostic tool to assess the nature of diseases. And what I tell most of my friends is that pathology deals with every bit that is removed from the human body during surgical procedures. And even though we don't have contact with patients, We play an essential role in patient management and provide crucial information for surgeons and oncologists that will practically define the treatment of patients. So how does my average day look like in pathology? The truth is that it's quite varied. Some days I start my day in the cut-up room, which is the place where surgical specimens, large or small, are described, sectioned, and turned into tissue blocks. Most days I would receive some cases in the form of glass slides, which I would screen and come up with a diagnosis. This is actually the most exciting bit of the job. Then I would meet up with a consultant to look at the slides together and come up with a report. These sessions are incredible one-on-one teaching opportunities. Some days I would perform a post-mortem examination, and occasionally we are involved in teaching of medical students. If you're interested in histopathology, you can apply for histopathology BST straight after intern year. And after working 2 years as an SHO, you can progress to HST after a successful interview. HST lasts 4 to 5 years. During the course of your training, you would be expected to sit 3 exams. The Part 1, which is a written test, the CHAT exam, which is an exam centered on postmortems, and the Part 2, which is a complex practical exam. After completing those and finishing your training, most trainees would go on a fellowship before completing the specialist training. There are 3 cities in Ireland with histopathology training, creating 4 hubs. After accepted for BST, NCHDs receive a contract for 2 years to work in one of the 4 hubs. After applying for HST, it is possible to apply to different cities and spend the HST there. Everyone in the histo training will spend 6 months outside of their home hub to get exposure to other departments to ensure a more versatile training. Is pathology for you? Well, there are many pros for histopathology, starting with the great knowledge that a histopathologist has of pathophysiology of diseases in general. It's quite a challenging field, and there is a lot to learn, so it isn't boring or repetitive. You get to work closely with other NCHDs and consultants, but mostly we manage our own days, and the schedule is more flexible than in other specialties. One of the best things about histo is the thrill when you come up with a correct diagnosis and when you learn to recognize more and more entities. And obviously, at least in my opinion, histology is beautiful. And being able to recognize diseases just from pink cells is quite cool. But histopathology is not for everyone. Some people would love more patient contact and feedback from patients. We don't have that much in histo. Unlike the rumors, it is not always a 9-to-5 job. Work-life balance might be better than in some specialties, but the rota can be variable and there are more stretched weeks. And since histology is a quickly developing field, you must commit to a lifelong learning. So how about calls? We as NCHDs don't have on-call duties, but consultants sometimes are required to be on-call off-site and come into the hospital if there is a need for urgent intraoperative frozen section diagnosis. So thank you, this was my presentation, and I hope this little presentation was helpful for you to decide if you're interested in histopathology.
Okay, so that brings us to the end of our talks. We have a little time here now for some Q&A. If anyone would like to ask some questions, we are joined now by the NSD for histopathology, Dr. Cynthia Heffron, and with the BST histopathology trainee rep, Dr. Katie Peacham. So if there are any queries, feel free to unmute yourself and speak up and ask anything you'd like to know. It's also worth knowing that BST and HST applications are now open. So if you're thinking of applying to BST, now is the time. You can get information on our website, and you can always email me. I'm Lauren Kirshner. I'll actually put up a slide for you now, so you can get my email address if you want it. Okay. Any questions?
Hi Lauren, it's Cynthia here.
Hi.
I can't, my video won't go on because if you'd want, it's saying you're stopping it. Oh. Hi. I hope the people online, I hope you got a lot out of the presentations. I think you've had a mix from the various NSDs and in the pathology disciplines and from all the trainees. There were some really nice presentations there. So I hope it's given you a flavour of what pathology is about and how varied it is and all the different disciplines within it. And as you probably saw from my own presentation, I'm a histopathologist. I've been in histopathology now 20 years, and it's, you know, every day, as Greta said in her presentation there, it's a lifelong commitment. A lot of people think it can be, you know, the hours can be quite good, and while we don't have a lot of on call and, you know, nights on call and things like that, I have to say the days are intense. It's a lot of work during the day. You don't have a minute to spare. There's just so much going on between the macro and the micro and the looking at slides. It's I don't know about you, Katie, as well. It's always very intense. You might be there 9 to 5 or 8 to 6 or whatever, but it's intense. But it's a great specialty, really rewarding, and I highly recommend it. And as Lauren said, the BST for histopathology applications are now open. But if any of you have any questions, please feel free to ask either myself or Katie, and we'll answer to the best of our abilities. I don't know, did you want to add anything there, Katie, on your experience as a...
Yeah, so I absolutely love it. I'm a second year BST now, and I'm delighted that I made the change. I had done obs and gynae before. It's so varied and it's so evolving. It's definitely lifelong learning. It's a steep learning curve at the beginning, but you get there in the end. And it's definitely a full-on day. There's no downtime at all, but you know, a busy day is a good day, I think.
I don't know if there's any other questions people might have in relation to histopathology. I think a lot of it got covered there by Greta. I suppose that's a big difference as well between histopathology and the other disciplines within pathology, is that histopathology has its own BST program, and that's how you get onto the HST program. You have to go through the BST program in histopathology, whereas the other pathology disciplines, you will go through other routes as they've outlined. You might do a BST in medicine and maybe do a few standalone years, or go directly into one of the HST programs in the given discipline. So that is a slight difference between histo and the rest of the pathologies. If you're interested in becoming a forensic pathologist, like a lot of people seem to think that that's what we do all the time as a histopathologist, you do have to come into histopathology training. And then when you finished your histopathology training, you would have to then subspecialize in forensic pathology to become a forensic pathologist. But fortunately, our work is much more varied, and it's just not all about autopsy. It's a component of our work, but a small component.
I suppose I'll just throw in a couple of things about applying for BST if you're thinking about applying. So the entry requirements are that you will need to have completed your internship by the start date of the program. So the next new intake will be in July of 2021. You'll need to be eligible for inclusion in the Trainee Specialist Division of the Medical Council at the time that you apply. And you'll need to have proof of competency in the English language as set out by the HSC. So if you have any queries about those things, you can get in touch with us and we can send you more information. It's also available on the website. Applications are open now, as I said, and for BST, they will close on Friday the 13th of November. So as I said, I've got the slide up there. If you have any queries for pathology at all, you can always contact me. And if you want to speak with any of our NSDs or trainee reps, I can put you in touch with any of them if you contact me first. And if you're thinking about any of the other specialties, so going into your BST and Gen Med, you can contact BST at RCPI and they'll be happy to talk you through any of the application process for GIM BST. And there's plenty of information available on the website. If you wanted to look through any of the curricula for the various specialties, they're available there to read through. And of course, anytime, just give me a shout and I'll be happy to point you in the right direction. So I suppose if we don't have any further queries, we might finish up. I'll give you one last chance. Anyone?
Because I could keep talking now here about how fantastic histopathology is. And certainly I never regretted making the decision to come into histopathology. It's just a fantastic discipline. I love it. If I could just look at the slides and that kind of thing all day, a lot of times now it's the administrative work or the other organizational things that you forget about, management issues are the things you forget about that you have to do. And if, you know, the histopathology side of it is fantastic. But, I better not bore everyone.
Okay, well, if we don't have any further questions from our guests, then I'd like to thank Dr. Heffron and Dr. Beecham for joining us today, and for, I know they're not here, but to all the MSTs and trainees who provided their talks today. If you do have any questions later, please feel free to get in touch with us. So thank you, everyone.
Thank you. Thanks, Lauren.